Salt water smells like emergency. It has a specific cold sharpness that enters through the sinuses and activates something beneath conscious thought. Something that says, prepare, that says something is about to require everything you have. I learned that on the Bering Sea in 2014, and I have not been able to unlearn it, which is why the neurology ward at Hargrove Memorial Hospital smells wrong to me every single morning. It smells of recycled air and floor cleaner and the particular dead warmth of a controlled environment that has no relationship to weather. No salt, no cold, no urgency in the air itself. My name is Joanna Reyes, and for 10 months I have been a staff nurse on the neuro ward, working in a unit that the chairman has made into a private kingdom, watching patients whose care depends on windows that do not wait. They thought I was a nurse who didn't know her place. Then Marine Major General David Carruthers walked down this corridor, called me by a name this building had never heard, Riptide, stood in front of a locked door, and apologized. Let me take you back to the morning before that. The Hargrove Neuro Ward is a 20-bed unit that manages acute stroke, post-craniotomy, and neurovascular patients, people whose outcomes are measured in minutes. The window for TPA administration in ischemic stroke is 4.5 hours from symptom onset. Miss that window, and the intervention is contraindicated. The window for thrombectomy is 24 hours. In a unit where time is the primary clinical variable, speed of recognition and decision is not a protocol preference. It is the mechanism of survival. I understood this in a way that I could not fully explain to the staff around me, because my understanding came from a context that none of them had shared. I was a Coast Guard aviation survival technician, a rescue swimmer, for 9 years, stationed at Air Station Kodiak, and deployed repeatedly to the Bering Sea. A rescue swimmer is the person lowered from the helicopter into the water when the water is the problem. The Bering Sea in winter is 20-foot swells, 0-degree wind chill, hypothermic patients in survival suits who have been in the water long enough that survival is not certain and deterioration is active. You assess in the water. You treat in the water. You make decisions about airway and circulation while both of you are in the Bering Sea in November with a helicopter above you whose fuel state limits your time, and you work inside that window or the window closes and you carry that home. I know about windows. I know them the way you know things that have been paid for. To the neuro ward staff, time-sensitive protocols were a procedural requirement. To me, they were the shape of the work itself, the boundary within which everything that mattered either happened or did not happen. I am 38 years old. I have a stillness that came from years of training in environments that punished any expenditure of energy that was not intentional. I move without urgency until urgency is warranted. And when it is warranted, I move with a quality that people who have not seen it describe afterward as frightening. I have been told this. I am not certain it is inaccurate. The man who controlled the neuro ward was Dr. Warren Holt, department chairman of neurology, the kind of specialist whose expertise had calcified over 20 years into a conviction that his judgment was the ceiling of what the room could know. He was 56. He had hospital board relationships and clinical prestige and the specific authority of a chairman who has been in position long enough that the institution has built itself around his preferences. He did not tolerate dissent from nursing staff. He had communicated this clearly, early, and in terms that left no interpretive room. Nurses on his unit documented, administered, and escalated. They did not assess independently, initiate protocols without order, or, as he had once said in a departmental meeting with 12 people present, practice medicine without the appropriate degree. He had said this looking at me. I had been on the unit for 3 weeks. The first confrontation happened on a Monday morning in front of the charge nurse, 2 residents, and a patient's family. Mrs. Dolores Vargas was in room 14, 47 years old, retired Army, Operation Iraqi Freedom veteran, admitted 36 hours prior with a transient ischemic attack that had been worked up and was being managed on antiplatelet therapy pending further imaging. I had been watching her since my shift began. Something about her presentation was evolving. Not dramatically, not in ways the chart reflected yet, but in ways that I could read from the doorway if I stood still enough and watched the right things. Her left arm had developed a subtle drift when she held it elevated. Her speech had the faint slurring quality of someone choosing words slightly more carefully than a person speaking naturally would. These were not documented findings. They were the kind of findings that live in the space between scheduled assessments, in the minutes that protocols do not cover. I flagged it to the resident on call. The resident reviewed Mrs. Vargas, documented that she was neurologically at baseline per assessment, and moved on. I escalated to the attending. The attending spoke to Holt. Holt reviewed the chart. Holt determined that the patient was being appropriately managed and that repeat imaging could wait for the scheduled morning slot. I went back to Mrs. Vargas's room. I sat in the chair beside her bed, not charting, not administering anything, just present in the way that I had been present in the Bering Sea, when the situation was still forming and had not yet declared itself. "You keep coming back," she said. She had the dry, direct speech pattern of someone who spent years in an environment where indirection was a liability. "I keep seeing something worth watching," I said. She looked at me with the flat assessment of a soldier recognizing a peer. "How long?" "Since about an hour ago," I said. "If I'm right, it'll declare itself in the next 2 hours. When it does, I need you to tell me immediately. Any change, anything different." "Copy that," she said. She said it without irony. I went back to the nurse's station. I documented my observations with the precise clinical language I had learned to use when writing things into a record that needed to survive scrutiny. I noted the arm drift. I noted the speech quality. I noted the time and the neurological significance of the findings in the context of her presentation. I sent the documentation to the attending with a note that said the TPA administration window, if an ischemic event was progressing, would close in 3 hours and 40 minutes. At 7:14 that morning, Dr. Holt came to the unit. He had my documentation in his hand, printed, which told me he had been sent it and had read it before arriving. He came directly to the nurse's station. He did not ask to speak privately. "Ms. Reyes," he said. The ward was doing its morning routine around us, and he had used his voice at the volume that made the routine pause. "I received a message from nursing staff at 6:50 this morning regarding TPA administration windows." "Yes," I said. "Mrs. Vargas's presentation has—" Mrs. Vargas was assessed by the resident and the attending and determined to be neurologically stable, he said. "She is on an appropriate antiplatelet protocol. There is no indication for thrombolytic therapy at this time. And I want to be very direct with you about something." He set the printed documentation on the counter between us with the deliberateness of someone placing an exhibit. "This unit does not operate by nursing instinct. This unit operates by neurological assessment conducted by neurologists. If you are uncomfortable with that model, I will arrange a transfer to a ward whose protocols better match your apparent preference for independent clinical judgment." The family waiting alcove was 3 steps from the nurse's station. I could see Mrs. Vargas's husband sitting there. He had heard everything. "Doctor," I said, "the window?" "Is not relevant," Holt said, "to a patient who does not require thrombolysis." He looked at the charge nurse. "I need Ms. Reyes's access to the unit's medication administration system suspended, pending a review of this morning's escalation. She is not to enter patient rooms until I have spoken with nursing administration." He looked at me. "Wait at the end of the corridor." I looked at him. I looked at the door of room 14 which was open, through which I could see Mrs. Vargas lying with her left arm at her side and her eyes on the ceiling. I looked at her husband in the waiting alcove. I walked to the end of the corridor. There is a door at the end of the Hargrove Neuro Ward that leads to the stairwell. It has a keypad lock. Holt's access suspension included that door. I learned this when I tried it and found it would not take my code. The supply alcove beside it was still open. I went into it and I stood among the IV bags and the wound care supplies and the smell of sterile packaging that is the same in every hospital on Earth. And I put my back against the shelf and I felt the cold of the metal through my scrubbed top, and I was absolutely still. I was not riptide anymore. I had not been riptide in 4 years. Not since the Board of Inquiry, not since the paperwork that had taken my designation and my record and filed them in a place where they could not speak for themselves. I was a neuro ward nurse with suspended medication access and a locked door between me and a patient whose arm was drifting. And the window that I had been counting in my head since 6:50 that morning had 2 hours and 11 minutes left in it. I thought about the Bering Sea. I thought about a November night in 2015, when I had been in the water with a Taiwanese fishing vessel crew for 47 minutes in 12-foot swells, when the hypothermia window for 3 of the 6 survivors was closing, and I had been making decisions about triage order in the water with a flashlight strapped to my helmet and a rescue harness and nothing else. 3 of them came home. I think about the other 3 at specific intervals that I have not been able to predict or control. I thought about Dolores Vargas, who had served in Iraq and come home and was lying in room 14 with her left arm at her side and her eyes on the ceiling. I thought about her husband in the waiting alcove, who had heard everything that had been said in front of him without being addressed once. I thought about windows. The supply alcove did not lock from the inside. I noted this. I went to the door at the end of the corridor. The keypad read my code and rejected it. I knocked. Nobody came. I went back to the supply alcove. I stood there for 4 minutes. I went back to the door. On the 3rd attempt, the door from the stairwell side opened from the inside. A resident coming through from the floor above, who held it for me with the automatic courtesy of someone who does not yet know what the politics of a unit are and has not learned to use a door as an instrument of exclusion. I went through. I went to room 14. The resident who had followed me through the door was still in the corridor, watching. I put on gloves. I went to Mrs. Vargas. "Left arm," I said. She raised it. The drift was worse than an hour ago. Not a subtle variation, but a clear, definable deficit, the arm falling 10 degrees in 4 seconds from the elevated position. "Speech," I said. "My words are—" She stopped. She found the word. "Slow," she said. It had taken a beat longer than it should have. 2 hours and 6 minutes. I went to the corridor. The resident was still there. He was young and trying to determine what the situation required of him. I understood the situation he was in, and I was not unsympathetic. "I need you to order a STAT CT angiogram and make the TPA call," I said. "I need you to do it in the next 10 minutes. If Dr. Holt reviews it and contradicts you, that is his decision. But the order needs to be in the system now, before the window closes." He looked at me. He looked at the door of room 14. "Dr. Holt said." "Dr. Holt is not in this corridor," I said. "You are. You have seen what I have seen. You know what a worsening arm drift means in a TIA patient at 38 hours. Make the call." He made the call. He ordered the CTA. He called the attending. He was shaking slightly when he made the call, the specific shake of a person doing something they have been told not to do by someone above them who is not present. And I recognized the shake because I had had it myself in the Bering Sea at 2 in the morning when the protocol said wait and the patient said now. The CTA came back 22 minutes later. It showed a left middle cerebral artery occlusion, partially formed, with a perfusion mismatch consistent with salvageable tissue. 1 hour and 44 minutes remaining in the thrombolysis window. The attending ordered TPA. I was not in the room for the administration. I was in the corridor outside, with my suspended access and my locked-out code in the supply alcove 10 feet behind me, when the medication went in. I watched through the window. Mrs. Vargas was awake and looking at the ceiling, and she had her left arm raised beside her, because I had asked her to tell me if anything changed, and she was doing the only thing she could do, which was demonstrate that she was still present and still fighting. Dr. Holt arrived at the unit at 9:47. He had been called by someone. I did not know who and chose not to find out. He came through the main unit door with the expression of a man who has been informed that the world has not done what he organized it to do. And he walked toward me with the flat certainty of someone who has decided that consequences are in order and is arriving to deliver them. He was 12 feet away when the stairwell door at the end of the corridor opened. It opened with more force than a person opening a door to pass through, the specific force of someone for whom doors are an architectural suggestion rather than a boundary. Marine Major General David Carruthers came through it with 2 aides and a bearing that changed the atmospheric pressure of the corridor in a way I can only describe as the quality the air takes when something large and certain enters a space that had organized itself around smaller certainties. He was in his dress uniform. He was 61 years old and had the face of someone who has spent decades in rooms where the stakes were terminal and has arrived at a place in his career where he does not have time for rooms where they are not. He looked at Holt. He looked at the locked unit door keypad. He looked at the resident who was standing very still near the nurse's station. He looked at me. The general's aide, without being asked, keyed a code into the door panel, a master override, the kind that exists for emergencies and for people whose rank supersedes the building's preferences. The door to the unit's secured medication corridor opened. Then Major General Carruthers looked at Dr. Holt, and he said, in a voice that carried the full length of the ward, without effort and without elevation, "The nurse you locked out of this unit recognized a progressing MCA occlusion that your team missed for 14 hours. The patient received TPA with 1 hour and 44 minutes to spare." He paused. "Would you like to discuss the window that almost closed while she was standing in a stairwell?" Holt's mouth opened. Nothing came from it that qualified as a response. The general turned to face me. Fully. The way you turn when you have something to say that requires the full weight of your attention to deliver it. "Petty Officer First Class Joanna Reyes," he said. Not to the corridor, not for the record, but to me directly, in the voice of a man addressing a specific person about a specific thing. "Coast Guard Aviation Survival Technician, Air Station Kodiak. 9 years of service, Bering Sea Rescue Operations. Rescue Swimmer of the Year, 2015. He stopped. The pause was not for effect. It was the pause of a person gathering something they have been carrying for a long time and choosing to put it down. "The Board of Inquiry in 2019, he said. "The determination that ended your service." I was completely still. "I was the reviewing officer," he said. "I signed the finding." He held my eyes. The finding was wrong. The circumstances of that rescue were conditions no swimmer should have been asked to operate in alone. And the determination that your judgment had contributed to the outcome was made under administrative pressure that I allowed to stand when I should have refused it. He did not look away. "I have been trying to locate you for 3 years to say that." The corridor was not silent. The monitors were doing their work, the ward was doing its work, but the human beings in it had gone still in the way people go still when they are witnessing something they understand is not meant for them, but that they cannot stop witnessing. 3 of 6 survivors, I said. My voice was the flat, measured voice I use when I am managing something large in a small container. 3 of 6, he said, in conditions that should not have had one. I know what that mission was. I know what you did. He held my eyes for one more moment. I am sorry, Petty Officer Reyes. I am sorry it took me this long to find you. I am sorry that when I did, you were standing outside a locked door. I had not cried in front of anyone since the Board of Inquiry in 2019. I did not cry in front of anyone now. I held the General's eyes, and I breathed at the rate I had chosen, and I let the thing he had said land where it needed to land, which was somewhere in the interior of me that had been waiting for it, without knowing it had been waiting. Thank you, sir, I said. He brought his hand up. The salute, sharp, complete, the kind that means something beyond protocol, the kind that is a statement rather than a formality. His 2 aides came to attention beside him with the clean, simultaneous sound of people who have been trained to be precise when precision matters. I returned it. My hand came up the way it always does when someone gives it permission, without deliberation, with the full muscle memory of 9 years and a designation that had been taken from my file, but had never left my hands. We held it. We brought it down. The General looked at Dr. Holt one final time. Not with contempt, not with the drama of a confrontation, but with the specific look of a person who has already made every necessary assessment and is simply confirming the result. He turned. He walked back through the door he had opened. His aides followed. I keyed my code into the unit panel. The access had been restored, by the aide, I understood, as part of whatever the override had accomplished. The door opened. I went through. I walked to room 14. Mrs. Vargas was awake, her left arm raised. The arm that 30 minutes ago had been drifting and was now holding steady at the elevation I had asked of it. She looked at me with the flat assessment of a soldier who has been told to hold a position and is holding it. "How's the arm?" I said. She raised it higher. Steady, deliberate. "Good," I said. I pulled the chair to the bedside. I sat down. I was not going to chart for a few minutes, and I was not going to administer anything, and I was not going to do anything except be present in the way that people need someone to be present after a thing has happened that required a great deal from everyone in the room. We sat together. 2 women who had been in places that asked more than the places asked for, and who had come back from them, and who were here now in this room with its recycled air that smelled of nothing salt-laden and nothing cold. And it was enough. "Iraq," she said after a while. 2004, Fallujah. "Bering Sea," I said. 2015. She nodded. She did not need more than that. Neither did I. I went back to the nurse's station an hour later. I leaned against the wall of the corridor with my hands in my scrub pockets, and I looked through the glass at the monitors, the waveforms, the numbers, the ongoing conversation that each body was having about its own continued existence. I watched the way I had watched the water from the helo hoist, looking for the disturbance before it became the wave, looking for what was about to require everything before it declared itself. The ward was quiet. The monitors were doing their work. The salt was not in the air, and it never would be, and I did not need it to be. Still here, still watching. If Joanna's story reached somewhere you weren't expecting, hit the like button and share this with someone who needs to hear it today. Subscribe to this channel. We tell the stories of the ones who stood outside locked doors and knew exactly what was on the other side. Drop a comment below and tell me what city you're watching from. I want to see how far this one reaches.